Hello, this is Dr. Shuvro H. I'm the Director of Interventional Therapies in Narayana group of hospitals across the country. Today I'm going to talk to you about uterine artery embolization and about uterine fibroids. Uterine fibroids, as you know, are the commonest tumor of the female reproductive tract. In fact, 1 in 3 women have uterine fibroids. Most of the time they're asymptomatic. Most women don't know that they have got uterine fibroids, but in 30% of them, uterine fibroids may be symptomatic. When symptomatic, they can present with increasing periods, increasing bleeding, pain during periods, urgency during passing urine, bowel symptoms, and sometimes pain in the back and upper thigh. These can be really cumbersome and troublesome for these ladies. But this tumor is a benign tumor almost always. About 1 in 500 uterine fibroids may harbor some malignancy. And these are temporary tumors. They are tumors during the reproductive period of the lady, which means that they would spontaneously regress after menopause. So these are tumors that are going to trouble a lady throughout the reproductive period, but are going to get better on their own after menopause. Now, when symptomatic uterine fibroid ladies go to doctors, they are often given a number of choices. Those choices include, sometimes they're given a choice of a hysterectomy. Now, as you can understand, that removing the whole uterus for a temporary benign tumor is probably not the right operation for most cases. In certain cases, yes. If it is associated with other conditions like endometriosis, bad adenomyosis, maybe. But routine fibroids should not be treated with a hysterectomy. Myomectomy, by which the fibroids are removed by surgery, is a good operation. But oftentimes it is an open operation. It involves a cutting, and large tumors are difficult to deal with. Sometimes hormones can be given, but the effect is usually temporary. One other treatment that is offered by interventionists is something called uterine artery embolization. The principle of this is that these uterine fibroids are very vascular. In other words, they're very hungry for blood. So if the blood supply to these can be stopped or reduced, then these fibroids become smaller, they shrink, they wither, and the symptoms, they get better in up to 92% of cases, up to 5 years. So this is actually a wonderful treatment. People recover very quickly. They come in for a day and most of the time are home the next day, and there is a very rapid return to activity. There is no scar, and of course this does not close the door for any subsequent therapy. If somebody needs a hysterectomy years later, they can still have it. Uterine fibroid embolization is usually very, very good in controlling symptoms. Now, it is done through one little nick through the groin, or maybe sometimes even from a little hole in the radial artery, and patients are usually awake, local anesthesia. There is some pain after the procedure, for which the pain can be significant, and therefore we do prescribe significant analgesia and some sleeping medications after the procedure. The procedure is usually well tolerated as long as people understand a few things that can happen, for example, a little bit of red or white vaginal discharge, etc. Now, another condition that is like a sister of the fibroid is called an adenomyosis. It is sort of similar, except that it is more diffuse. It involves the uterus in a more diffuse way. Uterine artery embolization is actually an excellent treatment for adenomyosis. And adenomyosis is very difficult to treat with any other surgical method. Although the success rate of uterine adenomyosis treatment is slightly less than that of fibroids, somewhere around the 78-80% mark, not the 90% mark. But it is still as good or better than other treatment modalities for adenomyosis. Just lastly, I'm often asked about pregnancy and ladies wanting to become pregnant, and they have got fibroids, and they want to consider uterine artery embolization. A couple of points are important here. When we first started doing uterine fibroids some 20-25 years ago in my UK center, now there's an experience of more than 4,000 uterine fibroids. I've been doing it for the last 20 years. All those years ago, young ladies who haven't had a baby were not considered candidates for uterine artery embolization. The logic was that it was considered that there is some ovarian dysfunction or reduction in ovarian function that happens with uterine artery embolization. It is important to understand that any procedure that is done on the uterus may or will reduce ovarian function to some extent. Uterine artery embolization doesn't reduce it to any more extent than any other technique. And particularly if certain techniques are adopted, trying to protect the ovarian circulation, for example, then this can be done. In fact, age-matched control, when young people are having uterine artery embolizations, it is seen that their ovarian function preservation is a lot better than the first set of ladies that we were doing in the early 2000s. They were older ladies, and therefore their ovarian function was worse. So in summary, today we were talking about uterine artery embolization as an excellent, in fact oftentimes I think as the go-to modality in a lady who is in their mid-30s or in their early 40s, who has got symptoms of uterine fibroid and want a treatment but doesn't want a hysterectomy. And why should they want a hysterectomy? So this offers a uterine sparing technique with excellent symptom reduction, with very rapid recovery back to normal life without a scar. Thank you.